I'd like to welcome Dr. Cassius Chaar, who's a professor up at Yale Medical School and one of the leading investigators in vascular disease, including venous disease. Thank you very much for agreeing to this podcast.
Thank you, Anil, for the invitation. Always a pleasure.
So, with Venus 2025 coming up, in Atlanta from February 16th to the 19th, you're the program chair. What's new? What's going on now?
Well, Anil, there are a lot of things that we tweaked and thought about ways to improve, and there are some new things that we've introduced in the program this year. I think the first thing is, we used to have what we call an IVUS competition, which was focused only on intravascular ultrasound and supported by Philips, and we changed this slightly. So we have really a case competition, and that was really spearheaded by the membership committee, where we'll invite trainees typically to present interesting cases or challenging cases, and there will be it will be a combination of voting and interaction from the audience, as well as peer review from experts and judges, in order to select the best team that will present the case, and also to present really the best case that will win the case competition. So it should be an educational session, and as well as very hopefully stimulate interaction and building teamwork among the membership of the American Venous Forum. So that's one. The second concept that was really brought by our president, Dr. Bush, and in the program committee we worked on and kind of refined, was to have something called the Doctor's Lounge. So the Doctor Lounge is a new concept. It's a 45-minute session where we have a clinical case scenario, a controversial case scenario in venous disease, and a panelist and a moderator and three panelists who are expert in that area of disease will introduce the case, will discuss, possibly how they would treat it for a period of 20 minutes. And then for the following 25 minutes, it's interactive with the audience. The audience is welcome to, share their experience, ask questions, provide potentially variations of the case scenario that can increase the challenging and the controversy in that case. And the discussion will go between the panelists and the audience to try to educate everyone about how potentially these cases can be treated or approached. And there will be three sessions. One of them will be on just the run-of-the-mill varicose veins with the reflux, and how different people, what devices they use for reflux. Do you use thermal, non-thermal? Do you use foam? Do you do stripping? And these will include also not only experts and panelists from the US, but also from outside the US. And that will shed light also not only on the practice in the US, but also on the practice internationally, and how these patients get treated in different parts of the world. Other sessions will include an iliofemoral DVT, a case of extensive iliofemoral DVT, and probably the last case will be focused on somebody with maybe May-Turner syndrome that may not have as much symptoms, but may have more cosmetic concerns, and how you would approach that patient. And I'm sure you see a fair amount of those patients, and a lot of us see those patients, and sometimes the answers are not straightforward, and the discussion will really be very rich and very, very enlightening. The last session that we introduced is in addition to the late breaking trial, which is going to bring the latest and greatest, there's a dedicated session of novel therapies and upcoming trials. And what we want to do with this session is try to bring trials that may not have preliminary data, but maybe are enrolling or just started enrollment, in order to leverage the society and the meeting as a platform to improve research, improve engagement from all its membership, and potentially for investigators to be able to recruit new centers or new collaborators that are interested in the kind of work they're doing. So these are the three probably major session. I'm personally very interested in collaboration in vascular disease in general and venous care as well. And I think the collaboration which combines research as well as quality improvement is key to improve the care of our patient. And that session is named Collaboration for Venous Care. And we want to see, we invited several speakers who have done this in our society and maybe outside the society to see how these interactions happen and how they can be optimized, leveraging, of course, the American Venous Forum as our standard platform.
I really like that idea about collaboration. When I walk around the American Venus Forum, I hear of so many different people's ideas and from different countries. Sometimes they have tools and techniques that I have never thought of, I never heard of, or not available in the US, and they sound really exciting. I like that aspect of meeting other people from other countries specifically because I get to learn a lot. And sometimes I bring those ideas back home and say, hey, you should try this, or this is a new idea. Can you talk a little bit about the international collaboration and interactions that we have at the meeting and how does the program address some of that?
Yeah, that's a great question. So I think one of the strength of the American Venus Forum is its international member and international community, and we have been blessed through the years, to have very engaged members who come present their work and also are interested to be involved and collaborate. And this year is no exception. Actually, this year we tried to highlight this and make sure it's on the forefront. There's two sessions, the international session and the Villa Vicencio, and those are mostly abstracts and presentation by international experts to bring to the audience. There's part of the session part of this session, every session that we have includes three moderators. So two moderators are from the United States and one moderator is international. So it was intentional this year to try to increase the engagement of the international members. People are really, paying significant amount of money to come to the US, attend the meeting, learn, but also interact and teach. And I'm sure that I look forward to hearing the talks as well as the comments and the input from the international members. And similar for the Doctors Lounge, we also have included one international panelist on every panel. So every Doctors Lounge have one person who is from outside the US who has expertise in that particular area and who will be providing their feedback. So I think the international community is going to have, and the international members are going to have a lot of impact and a lot of activities during AVF during Venus 2025.
It sounds really, really exciting. You've really taken the program to new directions and new heights. I'm really looking forward to the meeting and thank you very much for agreeing to this podcast. Looking forward to seeing everybody in Atlanta from February 16th through the 19th.
Please come. We'd love to see everyone. And don't forget, there's a night of celebration. If you come, we wanna learn, we wanna interact, and we wanna have fun. And the night of celebration will be Southern Hospitality on Tuesday evening. And I'm sure you will have a great time.
Thank
Thank
you
you.
so much.